Now, the issue of safety, something that I want to make sure the American public understand. It's not only safety when you inject somebody and they get maybe an idiosyncratic reaction, they get a little allergic reaction, they get pain. There's safety associated. Does the vaccine make you worse? And there are diseases in which you vaccinate someone, they get infected with what you're trying to protect them with, and you actually enhance the infection. You can get a good feel for that in animal models. So that's going to be interspersed at the same time that we're testing. We're going to try and make sure we don't have enhancement. So the worst possible thing you could do is vaccinate somebody to prevent infection and actually make them worse. Next, and finally, with regard, I'll get you to your question. Finally, with regard to therapies. I mean, we keep getting asked about therapies. There's a whole menu of therapies that are going into clinical trial. As I've told you all, and I'll repeat it again, the best way to get the best drug as quickly as possible is to do a randomized controlled trial so that you know, is it safe and is it effective? If it's not effective, get it off the board and go to the next thing. If it is effective, get it out to the people that need it. So you're going to be hearing over the next month or more about different drugs that are going to go into these randomized controlled trials. And I feel confident knowing about what this virus is and what we can do with it, that we will have some sort of therapy that give at least a partial, if not a very good protection in preventing progression of disease. And we'll be back here talking about that a lot, I'm sure. Thank you.
Tony, you can take a question.
If I could just get back to what you're saying about this idea of risk in drug manufacture, are you saying that at some point in the phase 2 trials, that if you're seeing some form of efficacy, that you may try to convince a laboratory to spool up production at that point so that there's a
Even before. When I go into phase 2, I'm going to find somebody that's going to make it. Well, partially the federal government, I think in some respects to de-risk it, but also investments by the companies. A lot of companies are not shy now about doing that. Usually when you do that at risk, John, you got to give some backup for them. And we've done that. We've put hundreds of millions of dollars into companies to try and make vaccines. I wouldn't hesitate to do that for a moment now.